He's the most unique doctor in the hospital, socially awkward, unable to express emotions well, yet gifted with an extraordinary medical intuition. While others hesitate, he's already simulating every procedure with pinpoint precision in his mind. When conventional treatments fail, he performs high-risk maneuvers to pull patients back from the edge of death. From operating on a fellow autistic patient, to successfully correcting a young boy's congenital heart defect, to separating the brains of conjoined twin sisters, behind every one of these medical miracles is Dr. Shaun Murphy, a doctor with autism, who turns relentless determination and extraordinary talent into life-saving miracles. In this unscripted reality, he challenges fate with nothing but a scalpel, touching hearts with every operation. Now let's continue diving into the story of Shaun Murphy. While cooking, Nadja accidentally burned her hand, but Shaun insisted she was a terrorist, saying the injury must have come from making explosives. No sooner had he finished speaking than Nadja suddenly claimed she couldn't breathe. While the other doctors were panicking, Shaun smiled and said, "Look at the monitor, there's no change. She's clearly faking it." But the test results were unexpected. Nadja's lungs were indeed showing signs of severe inflammation. Shaun pointed out that this level of inflammation would usually require inhaling a large amount of smoke. Cooking alone couldn't cause this. To get to the truth, the doctors performed a bronchoscopy and discovered inflammation in her bronchial tubes as well. Strangely, though, there were no traces of smoke inhalation. The team decided to conduct a mucosal biopsy to find out what caused the burn. But just then, Nadja's bronchial tubes began to hemorrhage, and they had to stop the exam. When Nadja woke up, Shaun questioned her about hiding her condition, but Nadja couldn't explain herself, which only made Shaun more suspicious. Suddenly, Nadja clutched her stomach in pain and vomited everything she had eaten the day before. Blood tests revealed methanol in her system, suggesting her lung and airway inflammation may have been caused by a corrosive chemical. The doctors, well versed in chemistry, quickly determined the substance was dimethyl sulfate, a compound used in both pesticides and chemical weapons. Shaun was also convinced that Nadja had to be working on a chemical bomb. He confronted Nadja again, demanding to know if she was a terrorist and what her real purpose was. Nadja grew furious at the accusation. Before the confrontation could escalate, she clutched her chest in pain again. Shaun knew immediately. It was a sign that her bronchitis was worsening. At this point, there were two treatment options. 1. Administer antibiotics, if Nadja was telling the truth and the inflammation was caused by bacteria. 2. Use steroids, if it was due to chemical exposure. These two treatments were incompatible. A wrong choice could kill her. Now the decision fell on Neil. As team leader, any mistake would be his responsibility. After a moment of hesitation, he made the call. Shaun tried to speak up again, but Neil had already decided. Another doctor gave Nadja an antibiotic injection. Almost instantly, the monitor showed her vitals crashing. Fortunately, Shaun acted fast and switched to steroids. Just as Shaun had predicted, the steroids worked. Nadja's condition began to stabilize. The doctors explained the situation to her. Shaun, however, was still trying to figure out if she really was a terrorist, but it turned out Shaun was only half right. Nadja's brother worked at a chemical factory and had stolen some dimethyl sulfate to make perfume for her. She kept the truth hidden to protect him from losing his job. It was a reason Shaun hadn't considered.
It's beautiful, but very stupid.
Later, during a stomach exam, Lim lifted Quinn's hospital gown, only to gasp and quickly pull it back down. Shaun immediately stated, "Quinn is a boy," but Quinn firmly identified as a girl. Shaun bluntly said, "Biologically, you're a boy." Everyone else realized Quinn was transgender, biologically male but identifying as female. Whatever the definition, it was clearly a deeply personal issue. During further examination, Shaun kept asking, "Do you wear dresses? Do you like pink? Do you use the men's or women's restroom?" Quinn clenched her teeth in frustration. Soon the results came back. Shaun's instincts were correct. The patient had testicular cancer. Normally, doctors would just remove the affected testicle, but that meant Quinn wouldn't be able to take hormone blockers for the time being. Upon hearing that, Quinn shook her head. Stopping the medication would cause facial hair and an Adam's apple to develop. She was at a critical stage. If she physically transformed into a man, it would be devastating. Shaun seized the moment and suggested, "Why not just remove both?" Quinn's grandmother, Ruth, immediately refused the moment she heard it. But Quinn saw this as a once-in-a-lifetime opportunity. She sought her parents' opinion, and they gave her their quiet support. Now it had become a family matter, and the doctors had to step out of the room. Later, Ruth even took Quinn's parents to court, accusing them of child abuse for allowing hormone blockers and damaging Quinn's body. The hospital had to hold a mediation meeting to help both sides understand each other. Quinn's parents finally opened up about the struggle they had been carrying inside. At school, Quinn had been bullied for being transgender. The boys mocked her. The girls thought she was a creep. That's why she wanted so badly to become a real girl. They believed they were helping their child survive. Ruth remained opposed. "How can a child this young even know what gender means?" she argued. Right then, Quinn began violently vomiting. Shaun examined her and found that the tumor had compressed her blood vessels. There was no longer any circulation. She needed immediate surgery. Now, they had to make a decision, and fast. One of the doctors proposed, this kind of life-altering decision shouldn't be rushed. Let the child decide their gender at 18. After some hesitation, Quinn's parents agreed to remove just one testicle for now. With the decision made, the doctors proceeded with the operation. The doctors removed the cancerous left testicle for Quinn. They thought it would be a straightforward procedure, but Quinn's vitals suddenly changed. All eyes turned to Shaun. Sure enough, Shaun glanced at the bruising on her abdomen and his mind instantly formed a mental animation. He realized it was internal bleeding. The doctors quickly opened Quinn's abdomen, and just as Shaun had predicted, they found a pool of blood inside. After a quick suture, Quinn was safely wheeled out of the operating room. But when she learned that only one testicle had been removed, she blamed her parents. At that moment, Lim stepped in to comfort her. No one is denying your right to choose, but you haven't fully formed your worldview yet, and we just don't want you to look back with regret. When you're an adult, you can make that decision for yourself. It was unclear whether Quinn fully understood, but she stubbornly declared, I promise I'll come back for gender confirmation surgery when I turn 18. Marcus promised he would help her fulfill that wish. With that, the matter finally came to a close. Spirit's heart grew outside her ribcage, so ever since she was a child, she was never allowed to go outside or let anyone hug her, because even a single touch could stop her heartbeat. This condition is called Ectopia Cordis. Finally, at 14 years old, Spirit's chest had grown enough that surgery became a possibility. The plan was to move the heart into the correct position. But after Shaun examined her, a new problem arose. Spirit's heart was a third larger than average. That meant her 14-year-old chest probably couldn't contain it yet. The doctors explained this to her and advised waiting until she turned 18. But Spirit shook her head. She didn't want to wait anymore. She had been confined to her room since she was little, with only electronic devices to keep her company. Now that she had finally made some friends, all she wanted was to leave behind the cold electronic devices, to experience the warmth of a hug and the pain of being hit. She turned to Shaun and gave him a pleading look. Shaun remained expressionless, but deep down, he decided to take a risk for her. He pored over medical texts and finally found a solution. They could enlarge her chest using a synthetic sternum, making room for the heart. But there was only one shot. If it failed, Spirit would die on the table. Still, the surgery went ahead, and Spirit lay on the operating table with unwavering determination. One doctor cut open her chest, then used an electric saw to sever the sternum. Working in perfect sync, the doctors moved Spirit's heart into her chest and fixed it in place with the artificial sternum. Against all odds, the surgery went smoothly. When Spirit woke up, the first thing she did was ask for a hug from her parents. It was the first time since she'd grown up that she was able to hold someone close and feel the warmth of another person's body. Hunter had been paralyzed from the waist down for 10 years. But one day, he suddenly felt pain in his thigh. Was I misdiagnosed? Did I waste 10 years in a wheelchair? Neil gave Hunter a full-body scan. He came back with good news and bad news. The good news, Hunter wasn't completely paralyzed. The bad news, they found a tumor in his cervical spine. His paralysis was caused by the tumor pressing on his brainstem. If they removed it, he could walk again. Hunter and his wife were overjoyed. However, while Neil and the other doctors were planning Hunter's surgery, a new problem emerged. After all these years, the tumor had grown significantly in size and had wrapped itself around his cervical spine. Even the slightest tremor during removal could cost him his life. Considering his safety, Neil spoke with Hunter again. Not removing the tumor would mean he could still live, but he'd remain in a wheelchair. If they insisted on removing it, dying on the table wasn't the worst outcome. There was a high chance Hunter could end up in a vegetative state. Even so, Hunter took his wife's hand and said, "I'm willing." But Cora wasn't satisfied. She didn't want him to take that risk. She was prepared to keep caring for him, just as she always had. The couple couldn't agree. Cora stormed out of the room in frustration. While doing his best to mediate between the couple, Neil finally learned the truth from Cora. She was afraid that once Hunter recovered, he wouldn't need her anymore. That fear had turned into deep pessimism. But Neil reassured her, if your love was that fragile, it would have ended long ago. You've made it through every hardship together. Don't underestimate what you've done for your family. Cora finally realized her place in Hunter's heart. She returned to the room and told her husband she would support him, no matter what. Hunter also told her that they had made a vow at their wedding. No matter poverty or death, they would never be apart. With Cora's decision, the surgery was finally able to proceed. But the danger was still very real. The doctors monitored Hunter constantly to make sure he didn't flatline. To remove the tumor with maximum precision, Neil had to use a microscope to carefully scrape away the cancer cells. But despite their caution, an accident occurred. One tiny tremor caused the tumor to press against his brainstem. In 20 seconds, Hunter would stop breathing. Shaun told them to stop the surgery, but Neil wasn't ready to give up. With incredible precision, he removed the tumor in under 20 seconds. Hunter had been reborn. When he woke up, he realized the surgery had worked. From this day forward, he could finally walk like a normal person again and live the happy life with his wife that they had missed out on for the past 10 years. Gretchen had never smiled, not since she was born. She had a rare condition, and the only solution was to take 2 nerves from her thigh and transplant them into her face. Then she could smile again. For Shaun, who dealt with cancer patients daily, this was a simple procedure, but still, he objected. The surgery was risky. In Shaun's eyes, it wasn't worth risking her life for something as non-essential as a smile. He listed all the potential dangers: brain hemorrhage, paralysis, even death. And then there was the financial burden. The costs of the procedure would be enormous, far beyond what an average family could afford. When Gretchen heard about the money, she lost confidence. She told the hospital she wanted to give up on treatment. Marcus suspected Shaun was behind it, and he confronted him. But to Shaun, he was just telling the truth. But Marcus flashes a big white grin and says to Shaun, "Smiles are really important for people. Without them, girls lose their way of feeling joy. Do you really want a pretty young lady to turn into someone who can't smile at all?" If it were another doctor, Marcus's words might have worked. But Shaun has autism, so he struggles to understand Marcus's meaning. He bluntly points out that Marcus's smile is fake, which makes Marcus turn around and leave, annoyed. So to figure out what Marcus truly meant, Shaun walks up to a colleague with an awkward, exaggerated grin. The colleague gets startled and says, "If you need to borrow money, just say so. No need to smile like that, it's creepy." This only leaves Shaun more confused about the meaning of smiling. Later, Marcus takes Shaun to see Gretchen, hoping to convince her to go through with the surgery. Gretchen finally revealed the real issue. It wasn't the risk. Her family simply couldn't afford it. Only then do they realize that the insurance company labeled this as a non-essential surgery and refused to cover it. Marcus then goes to the insurance company and explains Gretchen's situation, but of course, he's rejected. Marcus instantly gets furious, saying that if anything happens to the girl, the blame will fall squarely on them. Under this pressure, the insurance company surprisingly gives in. With that, the surgery can finally proceed. The doctors implant a nerve from Gretchen's thigh into her face and then use electric current to stimulate it. While she's still under anesthesia, Gretchen unconsciously smiles. But when she's wheeled out of the operating room, something goes wrong. She lies motionless on the bed, having fallen into a coma. Shaun steps in, takes one look, and realizes her brain has absorbed too much anesthesia, which means there's a chance she might already be brain dead. At this point, it all depends on Gretchen's will to survive, and no one could have seen this coming. Marcus can only offer his sincere apologies to the family. To try and wake her up, Shaun suggests stimulating Gretchen's optic nerve, hoping it might trigger brain activity. Alex gently brushes her eye with a cotton swab, and to everyone's relief, she responds, proving she's not brain dead. The family is overwhelmed with emotion, but Shaun stays completely indifferent, making the whole room fall into awkward silence. Not long after, Gretchen finally regains consciousness, though she still can't smile because her body hasn't yet adapted to the new nerve. But with electric stimulation, a faint smile slowly forms on her face, only for Shaun to immediately point out that it's a fake smile. Everyone bursts out laughing because honestly, who cares if it's fake? Smiles are contagious, and when everyone smiles together, happiness just naturally follows. During surgery, Caden suddenly sat up. Glancing down, he muttered, "Oh, you're just drilling into my foot? All right then, I'll go back to sleep." But out of nowhere, ha 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 ha! Regardless of how bad the gas smelled, Caden burst out laughing, and then immediately passed out, completely still. His blood pressure dropped rapidly while his heart rate shot up, clear signs that his life was in serious danger. Alex and Jared couldn't figure out the cause, so they turned to Caden's friend, the one who brought him to the hospital. The answer was shocking. During a game of truth or dare, Caden had chugged 5 pounds of laundry detergent. Right after drinking it, he collapsed to the ground and even broke his leg. Hearing this, Alex and Jared realized the real issue. Caden's stomach had likely been torn open. Emergency treatment was the only option. The doctors pumped his stomach and repaired the internal damage. All that remained was stitching him up. But just then, a nurse came in to notify the lead surgeon, Neil, that a more urgent case needed his attention. Neil thought for a moment, then handed the scalpel to Shaun, because he knew Shaun had the steadiest hands in the OR. But he underestimated one thing, Shaun's vulnerability. While stitching the wound, Shaun got distracted, just for a few seconds. But that brief moment nearly cost the patient his life. Even worse, Caden's condition took a complex turn. His body was both bleeding uncontrollably and forming clots at the same time. The team was thrown into chaos, and no matter which side they treated, the other would prove fatal. Morgan blamed Shaun for the crisis. Shaun, in that moment, replayed the entire surgery in his mind. He suspected that he might have accidentally nicked the arterial wall. Morgan didn't hesitate, reported. He needs to be held accountable, but if Shaun, who is on the autism spectrum, was reported, it would almost certainly cost him his job. The others couldn't bear it and wanted to take the blame for him. That's when Neil, the team leader, stepped in and shut down the argument. This isn't the time for blame. Saving the patient comes first. That's our job as doctors. His words finally brought calm to the team. Everyone, that is, except Shaun, who looked like he couldn't sit still, totally out of sorts. Neil sat him down for a one-on-one talk. That's when the truth came out. Glassman, the hospital president and Shaun's closest mentor, had been diagnosed with a malignant brain tumor. He had only about a year and a half left to live. Shaun had been working non-stop these past few days, searching for a treatment. His room was covered in formulas and diagrams. He'd poured every ounce of knowledge he had into this mission, so much so that it distracted him during surgery. When Glassman found out, he was furious, because this could spell the end of Shaun's medical career. Glassman clearly underestimated how much he meant to Shaun. Shaun did find a possible solution, but it required Glassman to get a biopsy for the most accurate results. And as for the patient, Shaun had also found a solution there, so Glassman had nothing to worry about. In the OR, Shaun laid out his plan. By inserting a catheter through the femoral artery, they could repair the vessel without open surgery. Still, it was a high-risk move. They only had one shot, but with no other options, the team went with Shaun's plan. Shaun volunteered to perform the procedure himself. Caden's crisis had been his fault. If Caden died, Shaun was prepared to take full responsibility, but Neil didn't see it that way. He was still the one in charge. Together, Shaun and Neil carefully navigated the equipment, and as it turned out, Shaun's plan worked. The surgery was a success. Later, Shaun got the news from Glassman. The biopsy revealed the tumor was benign. It could be managed with chemotherapy. Upon hearing the news, Shaun threw his arms around Glassman in a burst of emotion. It was one of the rare moments where Shaun broke through the constraints of his autism to initiate a hug with someone else. From that moment, Shaun made a decision. He would come clean to everyone about his mistake. As a doctor, he had to take responsibility, even if it meant losing his job. Glassman didn't stop him. Instead, he walked beside Shaun, ready to face the consequences together. And with that, season 1 of The Good Doctor comes to a close.